Hi learners, welcome back to another mini lesson. This time we're talking about the digestive system and the liver, gallbladder, and pancreas. So the liver is our body's largest internal organ. Remember, the largest organ is technically the skin on the outside, but the liver is the largest internal organ. And it's a very complex structure. This picture shows you where it's located, right up under the right side of the ribs and below the diaphragm. So it has multiple functions. Mostly it detoxifies and gets rid of waste, but it also manufactures and excretes bile. So when you think of bile, you may think of the gallbladder, but the gallbladder actually only houses the bile. The liver is responsible for manufacturing and excreting the bile, which is then housed in the gallbladder. Bile is important for emulsifying or breaking down fats. So it neutralizes the acidic chyme, and chyme was the food in the stomach, the mushed up food that combined with all the digestive juices in the stomach. So bile then neutralizes the acidic chyme, and then bile acids are synthesized or made from cholesterol. So bile contains cholesterol and also some fat-soluble vitamins, and all that comes from the liver. The liver is also important for removing the pigment bilirubin from the bloodstream and then getting rid of it, secreting it in the bile. And bilirubin is a byproduct of hemoglobin breakdown. So as red blood cells are destroyed, bilirubin is broken down and released. So macrophages, through the process of phagocytosis, destroy the red blood cells and break down and release bilirubin, and they are released into the liver and also into the spleen. And that's a dark yellow kind of color, and that's responsible for the brown color of feces, and it's also for the yellowish color of skin that we see in jaundice, and we're going to talk a lot about jaundice later on in this video. The liver is also responsible for removing excess blood sugar, excess glucose or sugar from the blood, and it stores the excess sugar as something called glycogen. So it stores the glucose as glycogen, and then it releases it a little bit at a time when we need it. When our blood sugar gets low, it releases the glycogen to raise our blood sugar back up. If we don't have enough glycogen stores, then the liver can do something really cool called gluconeogenesis. It can convert proteins and fats into glucose. So if we don't have enough glycogen, it actually makes new sugar through the process of gluconeogenesis. It converts proteins and fats into glucose and makes new sugar to bring our blood sugar back up. That process is called gluconeogenesis. The liver is also responsible for storing fat-soluble vitamins. Those vitamins are vitamin A, D, E, and K. And the liver is also important for blood clotting. It helps to manufacture blood clotting proteins, and we're going to talk about more in chapter 11. So keep that in mind. We'll talk about blood clotting in chapter 11, but the liver plays an important role in that. And like I said previously, the liver is very important in removing toxins from the blood. So people who have problems with their liver have problems removing toxins, and they build up, and then you end up with liver failure. All right, so here's a picture of how the liver kind of sits in relation to some of our other organs. So you see the green structure there is the gallbladder. It sits right up under the liver. The stomach nestles right under there, the duodenum, and then behind it is the major blood vessels. The liver is able to perform all these functions because venous blood comes directly from a major blood vessel called the hepatic portal vein and goes directly to the liver. And that blood vessel brings the end products of digestion through the liver for processing. So the hepatic portal vein has nothing to do with circulation. It doesn't provide blood cells to the liver. It provides the products of digestion where the food gets acted upon by those digestive enzymes from the bile. There's a hepatic artery and a hepatic vein that supply blood to the liver cells themselves that feed the organ, but the portal vein takes blood to the liver in order for the products of digestion to be acted on by digestive enzymes. So those liver cells secrete bile into narrow channels that converge on the underside of the liver, and they form the common hepatic duct. And you can see that on the picture there. So let's talk about what happens when the liver is not able to function normally. So this picture shows you a very diseased liver, or part of a diseased liver, and this is obviously an autopsy photo. Hepatitis is the term for inflammation of the liver, and there are several different types of hepatitis. Any inflammation of the liver can cause jaundice, and jaundice simply means yellowing of the skin from accumulation of bilirubin in the blood. Viral hepatitis is the most common cause, and there's 3 different types of viruses that can cause hepatitis. Hepatitis A, or HAV, is a highly contagious form of hepatitis, and it can cause a mild or severe infection. It's transmitted via the fecal-oral route or through contaminated food. It can occur in crowded places like schools or camps or institutions where people live together, dorms or hospitals or things like that. Hepatitis B, that is caused by the hepatitis B virus, or HBV, and that's transmitted through contact with blood or semen or vaginal secretions, saliva or needle sticks, or sharing contaminated needles like IV drug users. Some people can become chronic carriers of this virus in their blood. Hepatitis C, or HCV, is transmitted by blood-to-blood contact. This is often asymptomatic. About 50% of the people with this disease can be cured with antiviral treatments, but it can become chronic and can lead to cirrhosis. And hepatitis D is less common, and it usually only occurs when the person also has hepatitis B. Hepatitis E is very similar to hepatitis A, and you usually only see this in third world countries. Chronic hepatitis occurs when acute hepatitis is not healed after 6 months. So chronic just means it's ongoing, it lasts longer for 6 months. It progresses slowly, and it's usually very difficult to treat. Other causes of hepatitis besides viral include alcohol abuse, autoimmune hepatitis, and other disorders like diabetes, CMV, which is cytomegalovirus, and overuse of certain medications like acetaminophen, which is Tylenol. This picture shows you the image of a liver that has cirrhosis. And cirrhosis is an extensive fibrosis of the liver. You can see how it's very nodule and scarred. It should be very smooth and pink and healthy looking, but this is very, very scarred up. This is a chronic disease. It is irreversible, and basically the normal healthy tissue of the liver has been replaced with fibrous scar tissue. It is the 7th leading cause of death in the United States. The most common cause of cirrhosis is alcoholism, and like I said, it is incurable and irreversible. The treatment for it is symptomatic, meaning we can only treat the symptoms of it. We can't reverse the damage that's already been done. One of the problems with cirrhosis is when the blood flow to the portal vein gets backed up. Remember, the portal vein is bringing blood from the digestive tract, so the pressure in that portal vein starts to back up, and the back pressure produces ascites, which is an accumulation of fluid in the abdominal cavity. And then cancer of the liver, as a primary cancer, usually arises in somebody with chronic liver disease, usually from hepatitis B. And usually, this is uncommon to have cancer as a primary site. Usually, liver cancer results as a metastasis from cancer somewhere else, like lung cancer or colon cancer or prostate cancer. And just as a keynote, hepatitis A and B currently have vaccines available to prevent the disease. Some other liver disorders here, you can see these pictures are pretty striking. These pictures show jaundice. So we're going to talk a little bit about jaundice here in a minute, but the yellow pigmentation here you can see is pretty pronounced, is what you see in somebody with severe jaundice. So hemochromatosis, that first term there, hemochromatosis, is caused by too much iron that's been stored in the body. So normally the liver is responsible for processing iron and removing it from the blood. But in hemochromatosis, too much iron has been absorbed in the body, and it results in darkened skin, abnormal heart rhythms, joint pain, weight loss, and it can result in liver failure. In Wilson's disease, this is a genetic disease that results in an accumulation of too much copper. So too much copper has been absorbed and the liver can't excrete it, and it results in liver problems and also brain issues. So there's liver symptoms and brain symptoms as well. So it can result in vomiting, weakness, abdominal pain, and even Parkinson's-like symptoms. So neurological deficits, some motor weakness, things like that. So hemochromatosis is too much iron buildup. Wilson's disease is too much copper and inability to get rid of the copper in the blood. Hyperbilirubinemia, you should be able to break that term down. Emia means condition of the blood. Hyper means too much. And bilirubin is the root word in there. So too much bilirubin in the blood. So bilirubin is, again, the byproduct of breaking down red blood cells. So when the red blood cell is broken down, the yellow pigment is bilirubin, and that should be removed by the liver. And if it can't be removed, then it accumulates in the blood, and the end result will be jaundice. It's not uncommon in newborns. About 60% of full-term newborns have some sort of newborn jaundice. They call it physiologic jaundice, and about 80% of premature babies develop this hyperbilirubinemia that's normal. So it occurs in the first few days of life and then will resolve typically on its own. Sometimes they'll put them under what we call a billy lamp. So the sunlight will help the body process and get rid of the excess jaundice and the excess bilirubin. There's also something called breast milk jaundice, which occurs in a few percent of the babies, and there's no treatment necessary for that. And then there's something called breastfeeding failure jaundice, which results from difficulty in breastfeeding, and that usually resolves once a good breastfeeding routine is established. And then we have something called hemolytic disease of the newborn, and this occurs when there's what we call an Rh incompatibility between the mom and the baby. And this we discuss more in the female reproductive system, but basically if mom is Rh negative and baby is Rh positive, the blood types are incompatible at birth, and mom's antibodies attack baby's blood, and that can produce jaundice because too many red blood cells break down and release bilirubin and cause jaundice in the newborn, and it can result in liver failure if the baby's immature liver is overwhelmed. Okay, so here's some words to break down because it's a terminology class and we just can't get away from the words, right? So, chole means bile, emulse means to suspend in a liquid, gall also means bile. This is the old time word for bile. We don't use it as much anymore. And hepat means liver. Okay, so now let's talk about the gallbladder. The gallbladder lies on the underside of the liver, and it's a small sac that stores and concentrates the bile. So remember, the liver makes the bile, the gallbladder simply stores the bile. And the purpose of the bile is to break down and emulsify the fats. The cystic duct joins with the hepatic duct and forms the common bile duct. Gallstones, also called cholelithiasis, can form in the gallbladder from excess cholesterol, bile salts, and bile pigments. They can be very small or they can be very large. If they are very small, you can pass them on your own. Otherwise, they may get too big and get stuck inside the gallbladder or the ducts and may need to be surgically removed. No lie, I had somebody in the hospital one time who kept her removed gallstones and polished them up and made them into a bracelet. I swear that is true. That is a true story. Risk factors for gallstones include obesity, high cholesterol diets, multiple pregnancies, and rapid weight loss. So be aware when breaking down these terms, chole means bile, cyst means sac. So cholecyst refers to that bile sac or gallbladder, bladder or sac, it's the same thing. And then itis means inflammation of. So we're going to look at a slide with a bunch of different terms, but that's what you're going to be able to look at these terms and break them down. So cholecystitis, inflammation of that gallbladder. Cholecystitis can be acute or chronic, and it's usually associated with cholelithiasis. Cholelithiasis, that litho means stone. So if you have a stone in the gallbladder, it's going to cause inflammation. And then you may need a cholelithotomy. Litho means stone, otomy means incision into. Choledocholithiasis, that doco means duct. So that means there's a stone in the duct. So there you go. In jaundice, we talked about jaundice a lot. Another term for jaundice is icterus. And again, both mean yellow, caused by the same reasons. The yellow discoloration of the skin or the sclera of the eyes, the whites of the eyes, either one means yellowing of the skin. The jaundice can be caused by 3 different things. Obstructive jaundice is a result of a blockage of the bile between the liver and the duodenum. Usually it's gallstones in the common bile duct or a tumor at the head of the pancreas blocking that common bile duct. It could be hemolytic jaundice, which means that red blood cells are being destroyed so fast that the liver can't remove all the excess bilirubin fast enough. And we see this a lot in newborns. And the third type is hepatocellular jaundice. And this occurs when there's an infection or poison injuries to the liver cells, which prevents the removal of the bilirubin from the bloodstream. And this happens in viral hepatitis. Okay, so I gave you a couple of these words, but let's look at these words. They look huge, right? But if you know your word parts, then you should be able to break them down. They all share that chol word part, right? So they all have something to do with bile. So cholangiography, you're looking at an X-ray examination of the bile ducts, and you can use this to locate and identify an obstruction. A cholecystectomy, ectomy means removal of, so you're looking at a surgical removal of the gallbladder. ERCP, that's a big mouthful. That stands for endoscopic retrograde cholangiopancreatography. So that is a surgical procedure, an endoscopic procedure to look at the structures involved. ESWL stands for extracorporeal shockwave lithotripsy, which is a non-surgical method to break up kidney stones. I'm not sure why your book put it in here. We don't usually use ESWL for gallstones, usually just kidney stones. Cholecystitis is inflammation of the gallbladder. We've already said that. Cholelithiasis is the condition of having gallstones. Choledocholithiasis, now we've added the doco in the middle, which means the duct. So this is having the condition of having the gallstones in the bile duct. Cholangiogram is an X-ray procedure that usually uses contrast medium to look at the bile ducts. Usually they do this after the cholecystectomy to make sure everything's okay. A cholelithotomy is cutting into the gallbladder to remove the stones. Cholecystokinin is abbreviated CCK, and this is a hormone that's released by the duodenum when there's fat present in the duodenum, and it tells the gallbladder to contract and to squeeze out some bile. So it squeezes out some bile and then it emulsifies the fat. And then cholangiopancreatography, that is the CP in the ERCP, cholangiopancreatography. That's the image that they get when they're taking pictures of the bile ducts and part of the pancreas. You can see pancreato in there as pancreatography. So see, the words really aren't that terrible if you break them down into little puzzle pieces. Okay, and the last part of this chapter deals with the pancreas. So there's the pancreas. It looks like a little fish there snuggled in behind the duodenum. It's a kind of a spongy gland, has the head on one side and the tail on the other side. It functions as both an endocrine gland and an exocrine gland. In the endocrine chapter, we'll talk about its endocrine functions, but for the digestive system, we're going to talk about its exocrine functions. As an exocrine gland, it secretes digestive juices through the body and the head of the pancreas. It secretes digestive enzymes directly into the duodenum. And those pancreatic secretions are regulated by both the nervous system and the endocrine system. So it secretes some electrolytes, including an alkaline solution with sodium bicarbonate that helps neutralize the acidic chyme as it comes from the stomach. So that's kind of important because when the chyme leaves the stomach, it's very, very acidic. Remember, it's full of hydrochloric acid. And if it was still acidic when it entered the duodenum, it would just erode away the intestines as it passed through. It also contains enzymes, those amylases and lipases and trypsin and things like that breaks down the carbohydrates, the fats, and the proteins as the food bolus, the chyme, continues on through its digestive processes. So those secretions help to continue the digestive process. All right, so some disorders of the pancreas. Pancreatitis, that should make sense now, right? Itis means inflammation of. So pancreatitis, inflammation of the pancreas. This can be very, very painful. The acute portion of pancreatitis, it could be mild, or it could be very, very severe and life-threatening. You could have severe abdominal pain, nausea, vomiting, and have a life-threatening fall in blood pressure. There's also a chronic form where there's a progressive destruction in the pancreatic tissue. This progressive form can lead to malabsorption and diabetes. And malabsorption just means, mal means bad, and malabsorption just means there's a failure to absorb the appropriate nutrients, which can lead to diabetes and failure to gain weight. There's many causes of chronic pancreatitis. One of them is alcoholism, but you can also develop pancreatitis in response to biliary tract disease and gallstones. Pancreatic cancer is the 4th leading cause of cancer-related death. It occurs about twice as often in males as in females, usually ages of 40 to 60. In the early stages, it can be very difficult to diagnose because it's asymptomatic. And usually treatment involves surgical resection. And if you've ever heard of anyone with pancreatic cancer, I think Alex Trebek was diagnosed with pancreatic cancer. It's usually associated with a very high mortality rate because it's asymptomatic for so long. So it's usually pretty advanced by the time people are diagnosed with it. So usually it progresses very quickly. Diabetes is a common disorder that's associated with the pancreas because of the endocrine function. So in diabetes, the cells in the pancreas fail to produce insulin, or insulin production is severely reduced. And we discussed diabetes in depth in chapter 17. And then finally, cystic fibrosis. This is an inherited disease that appears in infancy or childhood, and it affects exocrine glands, including the pancreas. It also affects the respiratory system, the digestive system, and also the integumentary system. So it has a lot of systemic effects all over the body. Okay, so I think that's it for this mini lesson. I thank you for your time. The next mini lesson will be, I believe, the large intestine. So I think we're moving along pretty well in this system, and I look forward to seeing you again. Thanks for your attention.